Hello, Dr. Katwa here, and today I want to educate you about something very important, and that is consent. So, in a clinical setup, that means in a ward, emergency room, or clinic, what kind of permissions should a doctor or a nurse ask from you before doing various procedures? There are six different types of consent that can be taken by your doctor before doing various procedures, and I will list the types of procedures for each. So the first one is what we call implied consent. So implied consent is given by actions and not by words. So just by the mere fact that you have come to the hospital means that you have already given the doctor permission to do some basic things, like taking history from you, and also some basic non-invasive procedures like taking temperature from you. The second type of consent is called expressed consent, and this one the doctor has to ask for it from you, and you have to give it orally, and it is not written. So the doctor will say, can I check your tonsils? And then you'll say yes. So that's a more invasive procedure, and that involves procedures or examinations that are a bit more invasive, such as drawing blood from you for testing. That means examination of any form of cavity in your body, like your ears or your mouth or your nose, and others. So the third type of consent is called written informed consent, and this one is more detailed. So the doctor has to explain to you what they want to do in details for you to understand, and you have to understand both the benefits and the risk, and weigh between the benefits and the risk, and take your chances, in most cases knowing that you will benefit more and the risks are minimal. And this one involves a potentially life-threatening procedure, like a surgical procedure such as a cesarean section. So the consent has to be written, you have to be informed and be given information on it, and you have to agree that it's okay for the doctor to do the procedure, and you have to know the risk, and some of the times the risks will be listed to involve potential harm or death. The fourth type of consent is called presumed consent or emergency consent. So you arrive at the hospital unconscious, nobody from your family is there to give substituted consent, which I list later. So the doctor proceeds with the procedure, knowing that it's an emergency life-saving situation. And in some cases, in some jurisdiction, the doctor can go without any written document. Some jurisdictions like Kenya, the doctor can give substituted consent on your behalf when your family member is absent. In some other jurisdictions, a security personnel will do that instead, like a police officer or a security officer. The fifth type of consent is called substituted consent, and this one is for people who are incapacitated, like, for example, mentally ill patients. A substituted consent will be provided by a family member who is more capable of providing or else of understanding what is going on. So in this case, in the case of mental health patients, we do what we call involuntary admission form, and even while admitted, for any procedure that the patient has to undergo, a family member will have to sign a substituted consent. And then finally, number 6 is assent. Assent is a consent that is given by a child. So this is the child who is giving it, but the child is below the age of 18 years, but above the age whereby substituted consent may not be necessary. So let's say the child is 14, 15, 16, so they can be able to understand what is going on, but they are not young enough that a substituted consent that I discussed earlier is necessary. But now in most of these cases also, the assent has to be supervised by a person who is known to the child, like a parent or a guardian. What about withdrawal of consent? So in medical setups, consent can be withdrawn at any time, and once a consent is withdrawn, then the procedure has to end there instantly. So you can't go on with it legally, otherwise you'll be held liable if anything happens. You have to stop the procedure there and then to avoid legal liability. Stay informed. Thank you.